So let's look at what is the definition of nutrition. Nutrition is the process of providing or obtaining the food necessary for health and growth. Management is the way something is handled, careful treatment, supervising skills. Nutrition management is an approach to healthcare delivery that focuses on complex needs of the patient and emphasizes the coordination and prioritization of all needs. So let's just take a look at some of the data that we have, recent data related to diet. So the first is dietary fiber and gut microbiota. There is evidence that diets that are high in fat and low in fiber may promote gut microbiota dysbiosis. That is basically, it interferes with the type of bacteria, the good bacteria that exists in our gut. But what does a high fiber do? It actually brings back the good bacteria and eubiosis happens. That is, it promotes the right type of bacteria in the gut. Now, dietary fiber has been reported to be a major energy source of the intestinal bacteria and thus can be significantly affect the diversity of the gut microflora. The recent trend is towards plant-based diets. We dietitians have always been saying vegetables and fruits you need to take more, and India is taking very less of both of these types of food groups. The 2021 was made the International Year of Fruits and Vegetables. See how important it is even worldwide to make people realize the importance of fruits and vegetables and through that dietary fiber for health. So this is a new name with dietary without dairy. Is it for the larger population? Is it going to work? Because India is already lower in the protein that we take. But what are the advantages? If you take a lot of vegetables and fruits, there is weight control, there is blood pressure control, the lipid profile comes back to normalcy, and there is glucose control. So let's go through a meta-analysis of fiber and diabetes. There's the effect of dietary fiber on gut microbiota, increases in the abundance of bifidobacterium. The role of the dietary fiber is to increase the short-chain fatty acids. And what does this do? It actually reduces the inflammation and also reduces the insulin resistance. So glycemic control happens due to fiber intake. The A1C gets improved and there is weight reduction. Next is low carbohydrate diet, which is the latest trend too. A low carbohydrate diet significantly improved depression and the 3-month average HbA1c. And also it increased the short chain fatty acids, which we just saw reduces the inflammation and insulin sensitivity. And the bacteria which were produced are Roseburia, Ruminococcus, and Eubacteria. The GLP concentration 1 in the LCD group was higher than the LFD group. But how many clients, because they used an almond-based diet in India, how many people can afford that many almonds a day is a big question mark. So the next one is a different type of prevention, a lateral thinking, where in a continuous remote care intervention, focus was on reducing hyperglycemia through carbohydrate restricted nutrition therapy for 2 years. And what happened is there was actually the cumulative incidence of normoglycemia was more than 50%. and type 2 diabetes was only 2%. And this population were of 96 people, who 72 of them continued for 2 years, and in that they were impaired glucose tolerance. So only 3% moved to diabetes and the rest were in normoglycemia. So prevalence of metabolic syndrome, class 2 or other obesity were also reduced. So these results demonstrate a potential utility of an alternate approach to type 2 diabetes prevention. Carbohydrate restricted nutrition therapy delivered through continuous remote control to keep hand-holding the client for normalization of glycemia and improvement of related conditions. So I think this has a very important role to play in the Indian scenario. Let's run through the carbohydrate and how the diets have been done through the years. 800 BC Ayurveda classifies diabetes into two types, the Avarna and the Daktasya. The first type is caused when the channels in the body are blocked and aggravated by kapha dosha. This is the usual cause of adult onset diabetes. The next one affects the tissues and was classified later as juvenile diabetes. But the main problem is the digestion fire, or Agni as they call, is affected, and hence digestion is affected, and this can lead to the problem. So they spoke about having a larger meal at noon and a light breakfast and dinner, and also to avoid sweet and sour taste, which increase the kapha dosha. 15,000 BC, the Egyptians gave a high carbohydrate diet because they found that urine had sugar. So they thought they had to replace that. In 1780s, the French brought lower carbohydrate foods. In 1939, the Lawrence Line diet, where carb counting and the amount of carbohydrate foods was done. In the 50s, 20 to 40% of the diet was carbohydrate. In the 1980s, Professor M. Vishwanathan brought out the high complex carbohydrate, high fiber diet, which is basically whole grains and whole pulses, and with a lot of vegetables and fruits, which can control the glycemia. By the end of 1990, we moved back to the keto diet, a high-fat, low-carbohydrate diet. Now we are at low carbohydrate and a very low carbohydrate diet. Are these sustainable? This is a big question mark. Even as low as 30 grams carbohydrates a day, there are people who are making people follow these diets. 120 calories of carbs and the rest from protein and fat. And is it sustainable? Will digestion happen? These are very big question marks. So what is the way forward? A detailed diet history should be taken by a professional so that all the nuances are there and the details are in place related to the measurement of the diet. Customize the diet to the individual. Reduce the carbs per meal and use complex carbohydrates. Increase the protein and include it at least in 2 meals, if not all the 3, because India is very, very less in the amount of protein that we take every day. Lot of vegetables and fruits and the right type of fruits. Less snacks, have nuts for snacks. Now the EAR and RDA, which came out in the year 2020, we saw that the EAR, which prescribes a little less of protein, is more doable for the Indian scenario. So 0.6 grams per kg ideal body weight versus 1 gram per kg ideal body weight. So let's do a little bit of calculation in the very low carbohydrate diets. If a person's height is 158 centimeters, his weight is 65 kilos, the ideal weight should be 56 to 60 kilos. So if I put 0.6 per kg ideal body weight, the amount of protein to be taken is 36 grams. And if they are following a very low carbohydrate diet, 30 to 40 grams of carbohydrate. So let's take it as 40. So let's average it out to 40 grams of protein and 40 grams of carbohydrate. You would get only about 300 odd calories from these two. And what would you do for the rest of the calories? Are you going to get it from fat? Are we not the cardiac capital of the world? Can we digest it? These are all questions to be answered. So what are the complex carbohydrates you can include in the diet? Wheat, millets, roast, fermented and sprouted millets, because on roasting or sprouting or fermenting, the goitrogenic effect is lost. Red rice, semi-polished rice, fruits also have carbohydrates. So choose the low carbohydrate ones like musambi, or you can use papaya and guava and so on. Complex carbohydrates from vegetable, banana stem, banana flour, green leafy vegetables. We have the highest biodiversity in our country and a lot of beans. We have almost 5 to 6 types of beans variety, all our traditional vegetables. Protein, whole pulses whenever possible, dal every day for vegetarians, as dal sambar, or you can use it in other items like a dosa made out of dal, or an adai, which is a different type of dosa made out of dal, or a vegetable which includes dal also. Soybean, mushroom, milk paneer and curd. So kuch jyada karo is the mantra because everybody is taking less. In the non-vegetarian kingdom, eggs, fish and seafood and chicken are safe, but definitely grill them, use less oil in cooking. Fats, 15 ml of oil per day, half a liter per person per month. 10 ml can come from traditional oils and 5 ml can come from ghee or sunflower oil. Current scenario, the 4-member family would require 2 liters of oil per month, whereas they are taking 4 liters or even more sometimes. So what are the 5 food groups? Grains, proteins, vegetables, fruits, and dairy. All are important. You cannot drop, and all are important on a daily basis. So grains shift to whole grains. Proteins increase because we are doing very less. Vegetables increase the same. We are using 2 tablespoons when we have to use a cup or a cup and a half in each meal. Fresh fruits increase the same with the right type of fruits, and dairy around 400 ml per day in the coffee, tea, and the curd that you use, and it should be 2% milk. Indian spices, turmeric, we can use it in our regular, we don't need a turmeric latte. Cinnamon is anti-diabetic. Pepper, use a little in soup or rasam. Cumin for better digestion. Tulsi is good, and citron leaves is high antioxidants. There are superfoods such as moringa, which we have forgotten. Start using them. Curry leaves, please use it. Don't throw it out, but bite into it or grind it and put it into your food. Buy less of packaged foods. Even chips has trans fats and sugar, so let's be careful. Learn to cook a healthy meal. Don't look at the shows and learn, because too much oil and traditional food is not the home way of doing it. They add too much oil or they add sweet corn to everything, which is not good. Is there one diet that is good for all? Absolutely no. We have to do it, customize it, and customize the carbohydrate, protein, and fat. And this should be done according to the person's requirement. So this is a typical thali that one could use according to the My Plate. an 8-inch plate where quarter is grain, quarter is protein, and it is quarter is fruit and quarter is vegetable. And you can add an amla there too with a little dairy to add to the total food groups. But when you come to cups, it's about a cup of rice or millet, a cup of cooked dal, and 2 cups of vegetable, or 1 cup of vegetable and 1 cup of fruit. This is how it should be done. Let me give you an example of a patient who was 128 kg and actually went for a gynecology appointment but was wheeled into the bariatric unit. So she was just 30 years and has 3 children, did not want surgery and came for help. Options available, meal replacements. It's affordable to her, but she's tried earlier, did not like it, and dropped it and gained weight from 98 to 128. Regular diet, but weight gain was huge and was not ready to wait for a loss of 1.5 to 2 kgs per month. Was ready to do intermittent fasting, vegetarian, with no other health issues at that point. So she lost in 10 months 47% to 30% body fat. Her weight dropped from 128.8 kgs to 77.9 kg, almost 3.7 kg loss per month. She was so thrilled that she started fitting into dresses which she could never even imagine. And in 365 days, she had lost about 50.7 kgs and her BMI had come down to near normal, which was not there before. Her blood parameters, her fasting moved from 109 to 94 and her cholesterol moved from 239 to 217, and the VLDL, which was at 53, came down to 26, and she was moving towards the impaired glucose tolerance of A1C of 5.9, which came down to 5.6. Diet followed. Between 8 a.m. and 2 p.m., she did the 16-hour fasting, and she did pumpkin juice to start with, 2 cups of fruits, the right type of fruits, and she was vegetarian, so dal either as whole pulses or sprouts. Mid-morning, she had a coffee, no sugar. Lunch, she had 100 ml of curd, 200 grams of vegetable, and 100 grams of dal, either as dal or chila or adai or pesarat, which is dosas made from dal. 2 p.m., she had her coffee. She did extremely good exercise, the balanced diet. She reached almost the right proportions of carbohydrate, protein, and fat. No special foods, home-cooked foods, tweak for extra protein, pulses in different forms, vegetarian with dairy, no eggs, no protein supplements. Here's how to prevent muscle mass. Eat protein foods, because usually in weight loss, people lose muscle, which is not good. But eat protein foods and your muscle will be there. Do resistance exercise. And the client did 1 hour exercise with a professional trainer to make her muscles be intact, and slept for 7 hours. She got enough vitamin D too. So, how does 1.2 kg increase in muscle mass help in type 2 diabetes? No difference in insulin sensitivity, but definitely A1C comes down and medication comes down. How does 10% increase in skeletal muscle index help in pre-diabetes? It also 11% insulin resistance is reduced, and 12% pre-diabetes is reduced. So intermittent fasting for diabetes, you can even do a 14-hour fast with 10-hour feeds, and in 10 hours, only 2 meals and 1 snack. All 3 need protein to get the required quantity. diet that can be followed, 8 a.m. to 6 p.m. You can't sleep till 12 noon and eat from 12 to 8 p.m. Not done. You have to get up early. Breakfast, 1 cup of fruits, the ripe fruits. It can be followed by 1 grain item, either idli or roti or upma or poha. And then
I think it's time. We can wait for 2 minutes.
Lunch can be 200 ml of curd with vegetables and 100 grams of dal in whatever way possible. 6 p.m. could be milk, coffee or curd, 200 ml and 100 grams of dal in whatever form. So what decides what type of diet you follow? It's not one fix for all. It is the body type that is very important. Eating habits, that is where Ayurveda, according to Prakriti, can analyze your body type, and the eating habits has to be taken into detail. Type of exercise should be prescribed. And here Ayurveda helps because recently I have been doing integrated dietetics for the past 3-4 years very seriously with most patients who are ready to follow it. And we are able to crack the nut because we are able to give foods which are digestible to them according to their body type, the Prakriti, and according to that, they are actually digesting their food. So eating food is one thing, but digesting and assimilating food is another. And this works real wonders. So what is the way forward? It is integrated dietetics, where you actually can make the modern dietetics and you can analyze and work with the Ayurveda or Siddha Unani person and make them know the body type of the person, what are the foods they are able to digest and not digest, and tweak your diet according to that. So this is the way forward because we need to digest our food. To sustain the diet, it has to be comfortable. We as dietitians may give a lot of dal, but they have to be able to digest it. So we have to give it in forms and ways and include the spices to make it easy to digest. And this way, we can handhold our patients and help them to maintain their diabetes.